Hello, welcome. Well, first of all, um, once you come in, go ahead and let me know where you are joining me from. Let me know. We are going to be talking about painful nursing, how to avoid painful nursing with a few hacks. So, if you are pregnant, if you are going to be giving birth for the very first time, if you are interested in breastfeeding as a new mom and you want to try and avoid maybe some of the horror stories you've heard either online or with your close friends and family, then this is going to be the live for you. You definitely want to stay tuned. Save this live, come back to this live, use it as you may need to. But we are going to jump in. I have 3 different hacks for you that will help you to avoid painful latching. With that being said, my name is Stephanie Poole. I am a certified doula and lactation consultant. I am the founder of Birth Prep Academy, where we help first-time moms prepare for birth. So if that is you, then you are definitely in the right place today. All right, without further ado, let's just hop into this conversation. If you have questions, definitely leave them in the comments. I check all comments and respond accordingly. So definitely leave your questions there. I wanted to open up the conversation by simply just talking about, why is it important to learn this information? It's important to learn this information. Now, let me just give you a little bit of background of me and what my experience has been. So, like I mentioned, I am a certified lactation consultant. I am trained clinically, which means I have been on labor and delivery, helping new moms. I've literally helped tons and tons between my training and my private practice. And so, one of the things that I know for sure is that one of the most common reasons that moms quit breastfeeding is because of pain. There's a few others, but it is ranked in like one of the top 3 reasons why moms quit breastfeeding. And so that's why it's so important to learn this information so that once you get started, especially as a first-time mom, as you're entering, make sure that you leave below where you're joining me from. And if you have any questions, drop it in the comments because I will be answering questions on this live as well. So with that being said, it's so important to learn this information because learning how to breastfeed appropriately right from day one is going to have you have a smoother start into breastfeeding. If you have a smoother start into breastfeeding, you're more likely to keep it going. A lot of the moms that I see on labor and delivery are ready to quit almost after the first day, especially if they're having problems. And so jumping in and learning the techniques or learning the hacks that I'm going to show you today, and I have my my tablet here to definitely not miss anything for you. So jumping into the hacks here is gonna really help you to be able to have that smoother transition into motherhood and have a more positive breastfeeding experience, okay? So with that being said, one of the first things that I want to discuss is latch. How many of you are aware of what the perfect latch is? If you are, put latch in the comments for me. Put latch in the comments for me. I want to talk very quickly about latching and why it's important. One of the biggest reasons why you have dried or cracked nipples or painful latch or a painful breastfeeding experience is because of what we call an improper latch. Improper latch. What is an improper latch? An improper latch is when you are not latching deep enough. When you are not latching deep enough, it means that the baby is right on the tip of the nipple and the baby actually needs to be on the full breast. If that resonates with you, or if you understand what I'm trying to say in this particular hack, then let me know. Comment in the comments. Yes, I am a mom, by the way. Oh, wow. Hello, everybody. Okay, so with that being said, the very first hack is that you have to have a deep latch. If your baby is latching right here, right on the tip of the nipple, it will hurt. Even if it doesn't hurt initially, over time, that's a very sensitive area. The skin there is very, very sensitive. You will have some problems ongoing. You don't want dry or cracked nipples. That is a telltale sign that the baby is simply not latching deep enough. You need more than just the tip of the nipple. You need the full areola, that dark circle on your breast. You need that fully engaged in the baby's mouth when the baby is going to latch. That will give you a more comfortable latch. That will allow the milk to let down and full nutrition to occur. What we like to say is we need to make sure that the baby has enough of your breast inside in that latch so that they are actually having a transfer of the milk and the nutrients in your breast milk. Does that make sense to everyone? Does that make sense to everyone? The very first hack is you have to have a deep latch. You have to have a deep latch. All right, the next hack that I have is finding the right position. Now, this is where it gets interesting because I have Gracie here. That's what we're going to call her, Grace. And Grace is going to help me demonstrate one of the positions that I like to use with first-time moms and their newborn babies. Newborns are smaller. And so in order for the baby to get a good latch, right, from the very beginning, I like one of two holds. Most moms like the cradle hold, which is this. Most moms like that. It's comfortable and it's almost a go-to position. I think it's a go-to position because a lot of people see it whenever, they're looking up literature online about breastfeeding. It is a very common position that's used, and that is the cradle position, okay? In addition to the cradle position, you need to try what we call the football hold. And that means taking the baby from here, right, to here. You're going to turn the baby in, holding the baby, supporting the neck of the baby, right? And you're going to place the baby in a football hold. A football hold. Those are the most common that is easier, especially for my first-time moms who have small newborn babies. As the baby get older, there's a lot of other different positions you can use, but initially in the hospital or initially at home, the birthing center, wherever you're going to be birthing at, the two positions that I recommend for a really good latch for my first-time moms who want to breastfeed is either going to be the cradle position or the football hold. Does that make sense to everyone? If it does, drop yes in the comments. Drop yes in the comments. If those two positions make sense to you. Now, if you want more instruction, more in-depth guidance about how all of this pulls together, that is why I have resources for you that I'll talk about at the end. But you need to know that for the purpose of this live, we're talking about the 3 hacks that will help you to avoid painful nursing. The first one is making sure you have a nice deep latch. The second one is the holds, the positions. You need to try with your newborn either a cradle position or the football hold, which we just went over. Now, let me jump into, I have my notebook here that I want to make sure I'm not missing anything. The third hack that I want to try, or I want to make sure that I tell you about is if, let's say the first couple times you latch the baby, you're new, right? This is your first baby, and you're trying to figure out like, how can I, you know, soothe this soreness, because it's going to take practice. Let me just say that as well. It's going to take practice. There is a learning curve to breastfeeding. So, you know, when you do it, you're going to have to get into a rhythm. Your baby is learning you, and you are learning your baby. And so the first couple times that you latch, it is very likely that you will have to take the baby off and relatch in order to get a more comfortable latch, right? All of that is completely normal. Also, your breasts have to get used to so much stimulation. When you are nursing the baby every 2 to 3 hours, because we're talking about newborns here, right? If you're first time mom and you're breastfeeding, you will be breastfeeding very often, especially in those early days. And so that, you know, your breast has to get used to that. They may be so stopping, but instead of using like a nipple cream, the first thing I want you to do is discharge some of the breast milk and just rub that on the area. It is a little known thing, and I'm trying to get this word out, right, via this live and other points of my content. But breast milk is very good for skin irritation, for you and for your baby. So if your baby has a rash, put a little breast milk in their bath water. If your nipples are sore, take some and rub it right around the breast area. It will help with some of the inflammation and irritation in the skin. So definitely remember that. Just as a brief recap, let me just go over. I want to make sure I'm getting all of the information that I wanted to cover today. Okay, so let's just go over really quickly the 3 hacks that I mentioned. The very first one is getting a deep latch, making sure that the baby opens up wide enough and is actually taking in the full areola of your breast, the dark circle on your breast, not just the tip of the nipple. That will cause you pain. That's number 1. Number 2 is finding positions that will give your baby the deepest latch. For newborns, I personally like the cradle position, which Gracie's gonna help me here. I like the cradle position, and I like the football hold. So that means going from here to also utilizing this as a newborn. Once your baby gets older, there are different positions you can also try. If you want to know more about how to get into these positions and what it looks like to appropriately be latched as your baby gets onto the breast, then I have some resources available for you. I have my course, Bump to Bundle Blueprint. It includes everything to help you prepare for your birth. But for the sake of this live, we talked about the 2 positions being the cradle and the football hold. So keep that in mind. Hack 1, hack 2. The third hack is if you, in that learning curve stage, right, after you have the baby and you are practicing breastfeeding, anticipate that they may be a little sore. And that will be because of, you know, you're going from very little stimulation to lots of feedings. It's very common that your breast will become sore at some point. When they do, applying breast milk will help with some of that skin irritation and soreness. It is what we recommend in the hospital, over lanolin, over some of the other creams. We do recommend applying breast milk. One of the other things that they did on the floor, I worked on labor and delivery, and one of the things that they actually did was remove lanolin from the floor. And instead, if the mom had some discomfort, we encourage the breast milk to be applied. And then we also encourage a very, very light smear of like a very light Vaseline almost, but it should be very, very light. Only applied after the baby has already fed. So you're not putting a lot on there. It's not going to be something that the baby would taste. It would just literally, you apply the breast milk first. You allow that to kind of seep in, to kind of dry, and then you apply a very light cream, like Vaseline is what we recommend it at the hospital, labor and delivery. Now, there are some lanolins, there are some other breastfeeding creams that are available. I'm not saying that you should not use them. I'm just saying that there are more economically choices available. Usually you can, well, breast milk is free, right? You just have to discharge some of it and apply. And then also the Vaseline, a very, very light smear, is pennies, literally. So those options are budget friendly, but there are others available if you want to try some of those creams as well. Now, I will say this just to finish it off. One of the things that I occur when I go into rooms, right, of moms, first time moms that are breastfeeding for the very first time, most of them operate under the assumption that I don't think my baby's getting enough milk. I don't think they're eating enough. And what I want to say to you is trust this process. Trust the fact that the baby will tell you, right, from different signs that they are giving, even though they're not verbal, they are definitely communicating, even as newborns, to pay attention to those signs and to trust this process. Because in most of those cases, when I go in to assist in labor and delivery, most of those cases, the babies are in fact getting enough. They are in fact getting enough. So keep that in mind. If you have any further questions, I like to just get in, give you the pertinent information, and I want to be respectful of your time. So I won't hold you any longer. I will say that if you enjoyed this video, if you found it helpful in any way, please be sure to share it with another mom who could find this information helpful. Another pregnant mom who will be giving birth soon. Make sure you forward this to them. Share this content. It's so important to get this information out so that we can get more mothers breastfeeding, right? Comfortably. That's the whole point of this video, to get it done comfortably. If you want a more in-depth, oh, you are so welcome. You are so welcome. If you want a more in-depth training, if you want to work with me specifically, I have a course that's available, or you can book a one-on-one intensive. Both of those links will be in the description box. But I will be right back here tomorrow. I'm going live throughout the month of January, talking about all sorts of things concerning pregnancy, birth, postpartum, and breastfeeding. So every day we're going to be taking a new topic to talk about. Tomorrow, I am going to be talking about why birth plans are important, even if your birth doesn't go exactly as planned. And y'all, I'm a doula. I have some stories to tell when it comes to births not exactly going as planned. And I still stand 100% behind the idea of making a birth plan. Okay? That's that. Spoiler alert. That that's my opinion. But I'm going to go into that deeper tomorrow. So make sure you go in. That live is already scheduled. So what you can do is when you're done watching this, you can hop over to my channel. First of all, you need to subscribe if you haven't already. Girl, what are you even doing? And after you subscribe, make sure you hit the notify me button for the live tomorrow that's scheduled. I'll be going live tomorrow. I believe it's scheduled for noon Eastern Standard Time, talking about why birth plans are important even if birth doesn't go as planned. It's gonna be good, y'all. You definitely want to check in. Until tomorrow, I will see you. Happy birthday. Bye.